coronavirus, which is now spreading in a new variant. It is India's next layer of defense after administering over 185 crore vaccine doses. The drive is all set for a takeoff from this Sunday, 10th of April. In this phase, all adults or those above 18 years of age will be eligible for a booster shot or precautionary dose of COVID vaccine, as it is called in India. The prescription created by medical experts and signed by the union government says that if you are above 18 years of age, you are eligible. But compared to the mammoth vaccination phases, this time the vaccine will not be free. It would be available only at private centers. The eligibility criteria is that 9 months need to have lapsed between your second jab and next precautionary one. Don't take it lightly, as this is an important development, as a renewed surge in COVID infections in some countries, even in China, have raised concern over the duration of immunity with 2 doses of COVID vaccines. On March 14, Indian government removed the condition of comorbidities for the 60-plus population. Government says more than 2.4 crore precaution doses have already been administered to healthcare workers, frontline workers, and people above 60 years of age. 96% of all above 15 years of age have received at least 1 dose of COVID vaccine. Around 83% of all above 15 years of age have got both the shots of COVID vaccine. So on Urban Debate tonight, we want to understand, is this the best decision given the current circumstances? Will this help India fight if there will be another wave? Or should the government focus on vaccinating children and teenagers first, as only 45% of teenagers in the age group of 12 to 14 have got their first dose so far? Joining us on the broadcast on Urban Debate this evening is Dr. Subhash Salunke, Senior Advisor, Public Health Foundation of India and National Member of COVID-19 Task Force. Dr. Ravi Mehta, COVID Task Force Member, Karnataka. Dr. Rahul Pandit, Member, COVID Task Force, Maharashtra, joining us. Dr. Devraj Jash, Consultant Pulmonologist, Apollo Hospitals, Kolkata, also joining us on the broadcast this evening. Thank you very much, gentlemen, all of you, for joining us here on Urban Debate on Mirror Now this evening. Dr. Salunke, let me begin the discussion with you. Is this the best decision given the current situation?
Absolutely. It is one of the best. As a matter of fact, I feel it should have been taken earlier. I mean, why did we, allow this particular time lapse when the decision was taken initially for allowing the booster dose or so-called precautionary dose? We could have been even made available to the people who not only comorbid, but those who are in the high-risk categories. And that is the reason that at least, there se aaye, durust aa gaye. So it doesn't matter. Now, this is a decision which will help us. And as you have very rightly stated, through your channel, I would like to insist to those who are, viewing this show that we are not out of the woods. We are very much in the pandemic. Let us not talk about endemicity and, that we should be able to enjoy life without any precautions to be taken, that the mask is not useful. It is very much useful. You cannot do away the basic precautions needed to prevent transmission of viral infection. That is out of question. So from that perspective, additionality of one of the measures of protection will be the booster dose. 9 months duration, which has been indicated, is okay, fair enough. Even if it is reduced also, there won't be any harm. But I think this is a very good decision and it will certainly help India. Right now, we are in a very comfortable position, but nobody can guarantee that we will remain in a comfortable position if there are going to be, variants which are likely to become, variants of concern. So from that perspective, lowering the guard will be an absolutely idiotic way of the way we will be responding. So this is one step which Government of India has taken, very positive, and could have been done even a little earlier. That's my personal view.
Okay, interesting. Dr. Ravi Mehta, how will you like to respond to this decision that has been taken by the government today? Do all adults need booster shots?
Well, it's a big controversy because we first initially jumped on the booster bandwagon when COVID was playing its active dance, and we saw that every country in the world, developed country, was offering the booster. We saw Israel do it, we saw the United States do it, we saw UK do it, Europe do it, and we all felt it's very important. Over time, we realized that this booster, by and large, protects you from moderate to severe disease. It won't do much for infection because, despite the booster, most of the people got infected. But the whole question in hand is at this point, we don't have too many options. We know that the second dose immunity will run out. Will the immunity last beyond for certain aspects which have been talked about? We don't know. We don't know if the native COVID infection, which was so wide in the third wave, will protect us or no. So in the absence of further information and following the example of other countries, it makes sense to go ahead with the booster at this point. This is where we stand at this point. More importantly is whom to give the booster. I think the maximum thing is that it should be given to the people who first are going to benefit from it. The elderly, the debilitated, which was already approved a while ago, the immune compromised and so on. The second would be the actual socially mobile people. Those are the ones who are going to be the harbinger of getting COVID back in as happened in the second wave. So it's important that this is targeted quickly. Stocks, of course, seem to be quite okay. There is a comprehensive monitoring of what goes on. And end of the day, this is a science which is going to change every 2 months. So we'll have to keep a keen eye on what is going on. But at this point, presumptively, makes sense. And it is veering in the side of let's do it rather than sit on the side and watch for things to happen.
Okay, interesting. Dr. Debraj, now since the booster dose for adults from 18 to 59 years of age will not be free, people will have to pay for it. So only those who want it will be taking it, isn't it? Then government is not really making it mandatory.
I agree with Dr. Mehta that the immunity and the clinical protection usually falls below a rate which is deemed sufficient to protect against the infection. So with every individual, with passage of times, whether we will call it antibody or whether we will call it any other types of immunity, that falls with the time. Now, the vaccine doesn't prevent against the infection, but it prevents the severity. So although we all know that elderly individuals are more susceptible, but with our experience, we all knew that even although in a much lesser number in the third wave, but we all knew that even the young and the middle-aged persons without any comorbidities, we also have seen patients suffering from diseases. Now in a family, or even if the number is 1 to 2 out of 100, the person who is losing the life is the most important. So I will recommend every individuals to get the booster dose. Whether it will be effective or whether it will be not effective, that's a matter of debate, or it will be effective, but in some individuals it may not be effective. But it will not cause any kind of harm. The contrary to all the reports, as we all know that with the passage of time and as more and more literature we are seeing about the efficacy and side effect of the vaccination, more or less most of the vaccines which we are using nowadays and most of the vaccines which are available in our country, to the best of our knowledge, most of the vaccines are safe. So I will recommend, and there is a misconception and miscommunication among many of the individuals that persons who are having allergies or persons who are having asthma or having most of the comorbidities should avoid taking vaccines. On the contrary, the persons with many comorbidities or persons who are having asthma or allergy can safely take those vaccines, provided they are taking the precautions at the site of administration. So my message will be very clear that every individual should take the precautionary dose, provided the passage of time, or because we all know in our country most of the persons suffer from Omicron around January month. So they should wait for the 3-month period to get the precautionary dose, but everyone should take the precautionary dose.
Okay, everyone should take this precautionary dose, but Dr. Rahul Pandit, since it is going to be available only at private centers, people will have to pay for it. I'm sure not many will come out, because we have seen not many coming out for their second dose as well on time. So how do you see this decision of the government today to open booster shots for everyone above 18 years of age, in a way trying to suggest that those who want it, they can take it, but not really making it mandatory? Is this the right thing to do?
So overall, I think it's a very welcome move. There is no doubt about that. We all have been saying that most individuals will require an additional dose or a precautionary dose once the 9 months have gone past a second dose. So the government has obviously thought about that and given out a mandate that the private hospitals now can vaccinate people who are above 18. And obviously not falling into the category under which the free vaccination is right now happening. Yes, they will have to probably pay for it. And that will obviously again depend on how aggressively we do the IEC of the same, and how we make people understand that the vaccines need to be taken up as per the mandate given by the government of India. Right now, also the adult vaccination program, only some part of that actually has anything which is given out free, which is the COVID-19 of it. Everything else which we do as a part of adult vaccination is a part of payment which the patient has to bear from their own pocket. So I don't think it's any different policy where national vaccination policy is limited to the children right now. And government is also obviously slowly trying to go back towards what would be a larger vaccination program, which would probably go across for several months and years to go forward. I think this is a move which is actually in the right direction, absolutely.
Okay, it's a move in the right direction. But Dr. Salunke, coming back to you, if it is not mandatory right now, then what is the objective really of a booster shot? What are we looking forward to by this particular phase of the vaccination drive?
As a matter of fact, even initial period also, there was no mandatory vaccination. Government of India or the state governments did not force people that you must come and you will have to take the vaccine. Vaccination right from the inception in our country has been voluntarily based upon community participation, appropriate advocacy, and that approach will continue. However, it is absolutely essential that the advocacy and the communication campaign need to be launched so that those who are in the category of 15 to say 60 years of age, and even though they may not have the comorbidities or vulnerabilities, but at the same time, that stage of pandemic that we are in, it is really essential, and it is proved now beyond doubt that those who are vaccinated, the severity of illness is infection is not prevented, agreed, but the severity of illness is definitely low. Probability of admission in the ICUs are low, and the probability of death is also low. This message has to go, and the communication to the younger population, which is highly mobile, which is also economic, they are the one on which both society and their family also depends on. So from their perspective, investing a little bit of money for taking the vaccine, even in the private sector, as far as I am concerned, as a public health person, I personally feel, even though adult vaccination has not been totally free, only the pediatric population or child population vaccination as a part of the national vaccination program has been free. But I personally feel public health programs, and this is a public health program related to public health emergency, even though we are comparatively at a lower stage, still then, given choice, I would have liked the entire vaccination program of this country to be totally free. However, government in its wisdom has decided to take it in that particular direction. They have some reasons to do that. There must be a justification why the charges are going to be leveled for those who are going to take from the private sector. I'm pretty certain those who are going to take in the public sector may not have to pay. That is my perception. However, even if the payment is going to be there and it is not too huge, it is worth an investment from the perspective of an individual who is likely to get exposed, because as I explained initially, we are definitely not out of the pandemic at this stage. What's happening in China, what's happening in neighboring countries are clear indication. They are early warning signals that we have to keep ourselves prepared to fight possible such outbreaks or spurts that may occur. We shouldn't allow the lowering of the guard. Definitely not.
Dr. Ravi Mehta, that's the point. As Dr. Salunke mentioned, that we are not out of the pandemic yet. It is clearly worth an investment for the people of this country. Clearly, this is going to add an extra layer of security, safety at a time when some countries are today badly impacted because of Omicron variant and the way it is spreading. It is highly transmissible, but if all above 18 years of age, if all from the age of 18 to 59 do not take this booster dose, will this not help India's fight against COVID pandemic if there is another wave?
So that's a very hypothetical question. That's the right version of it. That what, COVID is going to there, COVID is going to come, and the only way we're going to be prepared is like we tried to do in the first, second wave. Let's vaccinate everybody. But that's not the stand which has been taken this time. And the reasons will, I think, be evident over time why people have taken this sort of stand. But we know that two, three things are very clear. First of all, the government, by giving this mandate, has put its legitimacy on the booster dose. It has taken away those ambiguous terms like precautionary dose, which are meant for only a certain segment of the population. And now anybody who thinks that they need to be protected from COVID-19 have access to it, at least from the official perspective. Secondly, as we get mobile, we are definitely, if we continue testing in some measure or the other, we will see more numbers. It's a known thing, whether we call it endemic, pandemic, or whatever. In such a situation, there's always going to be alarm, and there's always an official stand that there is a vaccine available for you in case your immunity is waning out and you need to protect yourself. Third is that a lot of these things have got repercussions. For example, down the line, people may say that the booster dose is important for you to go abroad and so on and so forth. You don't know which country outside will come out with what policy. Like we said, Israel give the fourth dose. So these things also may come over time. So this is, I think, a sort of a cautious preliminary, but a definitive step to declare that the government says, go ahead and do this. We are veering on the side of caution, and we are putting a legitimate stamp on it, and we're giving you access to it. And the fallout of this, repercussions over time, aspects of COVID coming and not coming, all will be evident as time goes by. We hope in our hearts it doesn't. But if it does, these are welcome moves towards opening it up without any sort of restriction, any sort of prohibition, and allowing people to take a stand which is good for their own health.
Okay, interesting point of view there, Dr. Ravi Mehta. Now, going across to Dr. Rahul Pandit once again, and I want to understand from you, for the people in the age group of 18 to 59 who will become eligible for this booster dose from this Sunday, how has been the impact of the booster dose in the people above the age of 60 years who've already got it? Any specific symptoms that you've noticed in people who have got their third dose already?
So from a doctor's perspective, if I look at, from a clinician's perspective, if I look at the population, certainly even after the second dose and after the additional dose which the frontline workers, healthcare workers and above 60 got, there was a significant drop in terms of hospitalization and in terms of mortality as well as morbidity. The infections probably were not easy to count because we had a large population which got infected with the Omicron between January and February. So it was not very easy to sort of estimate that. So I think, first of all, they all should understand that it works very well. Secondly, there have been absolutely no effects which have come to my clinical practice, which have said that there has been a side effect or there has been an untoward effect of the third dose of the vaccine as such. And we've now vaccinated more than 100 crore people with the vaccine dose. And we have our own data, which is available in the public domain. I think there should be enough confidence in everyone to follow the Government of India and the ICMR guidelines on this. There should not be an iota of doubt in our mind. We should follow what the government says. And if the government has brought out this dose for the population between 18 and 59, they have given a thought to all of these things before rolling it out. So I think these doubts should be now put to rest because several crore doses have now gone across. There is no doubt about that.
Well, yes, as far as precautionary doses are concerned, over 2.4 crore have been administered already to the population which is eligible for this booster shot. Dr. Debraj, anything on side effects that you can tell us? Because, you know, there are many who are still worried. There is some amount of vaccine hesitancy that we are still seeing in some parts of the country. What will you like to say?
The first vaccine which was given in India was probably on 17th of January. Fortunately, I'm one of the few doctors who have got the opportunity to take it on the very first day. So from the experience of around 1 year and 3 months, we can confidently tell that it has got very minimal side effect, which almost all the vaccines which are available vaccine, not only COVID, but any vaccines, influenza, pneumonia vaccine, the most common side effect is a mild fever. So you need not to take any kind of antibiotics even for that. Just paracetamol, oral paracetamol will be sufficient. Apart from that mild fever, although there are some reports of seizures or GB syndrome, but these are very rare. So you need not to concentrate regarding the side effects. As I earlier told you, that we should be more concerned regarding the effects rather than the minor side effects. From our experience in our center over the last 15 months, we didn't get any kind of major side effects, and only 1 or 2 minor side effects, and some hospitalization which happened was mainly due to panic reasons or something. We didn't get any documented side effects or documented clinical proof of any mal effects or the side effects of the vaccine. So I don't think there is any reason to get panicky hearing the stories of side effects. Everyone should be encouraged to take the precautionary dose. Don't worry about the side effects.
Okay, don't worry about the side effect, and this is very, very important for each one of us in this fight against COVID pandemic. Now, I want to ask all of you about the gap which is there between the second dose and this so-called booster shot or precautionary dose. Dr. Salunke, let's begin with you. The gap of 9 months, is it too long or sufficient? Do we have any sort of data or study to indicate what should be the right amount of gap between two doses, especially the second and the booster shot?
Yeah, actually, the NTG or the expert group which is functioning at the Government of India level has gone through both the national data as well as international data and seeing the levels of antibodies, how it is responded, etc., etc. So it is not an ad hoc decision of keeping this as a 9 months. So 9 months have been calculated from second dose to the booster dose. And then, after all, we are not discussing at an individual level. Individual level things will differ. Somebody will say that why not at 8 months, why not at 7 months? But overall, from the national perspective and public health perspective, this duration is appropriate. A few weeks earlier or later won't make much difference from the individual perspective, but this has a definite scientific basis for working out why 9 months, depending upon the antibody titers, protection levels, whether this itself is going to result into further sort of transmission possibilities, further the persons are going to be safer or saved from the complications. So all these issues have been discussed and studied at the level of expertise at the Government of India. So I think 9 months is an appropriate duration. As I say, it's not sacrosanct by that why only exact date. A few weeks here, a few weeks later won't make any difference. But this overall, the duration range is absolutely appropriate.
Dr. Rahul Pandit, where do you stand on the duration, the gap that we have between the second dose and the booster shot?
I concur with Dr. Salunke. I don't think that this has been just an arbitrary figure picked out of the hat. It has got a scientific basis for that. And a few weeks before or after really does not make a difference. I completely concur with what he said. I don't have anything different to add to it.
Okay, Dr. Ravi Mehta, do you also agree?
Yeah, more or less, the whole thing has been the duration of definition of immunity, the reduction of immunity which mandates or which necessitates a booster is 6 to 9 months. The data came strongest for the mRNA vaccines, which showed a dip at 6 months, and that was for one type of antibody. The other type of antibodies could be going on. Now we have so many vaccines in the market now. We have 3, 4 of them. So I don't think there's been enough studies to figure out this one dips at this time and so on. So the average ballpark figure is 6 to 9 months. And the decision of 9 months has been taken, which seems to be quite fair, considering that we do have time at this point to get people on board. COVID is at an ebb right now. So it's a decision taken most likely on that basis. Accurately why and what, I think time will tell us. But 6 to 9 months is the ballpark figure most countries have agreed to.
6 to 9 months is what most countries are following. Dr. Debraj, what's your opinion? And can also India now consider mix and match of vaccines in this particular phase?
I agree with everyone because the decision or all the journals which have been publishing the data regarding the booster doses, 2 articles are available. So the date, it is mostly between 6 to 9 months. So, and government must have taken into consideration all the data before taking into their decision. And regarding the mix match of all the vaccines, we predominantly had 2 kinds of vaccines, Covishield and Covaxin, although we had all those kinds of vaccine. And the data regarding the precautionary dose or booster dose is more or less similar between Covishield and Covaxin, which most of the persons in our country took already. So I agree with the government's decision to take the vaccine after 9 months.
Okay. Dr. Rahul Pandit, now will children also require booster shots eventually?
Interesting question to an adult intensivist. So it's yeah, I think the population will need to be protected. We will need to have scientific data to actually suggest or recommend any further vaccination for the children. From the sounds of it, as we all know that the antibodies do go down, but children is a completely different population. The antibodies may not behave in the same way in adults as they would do in the children. So I think it's better to have proper data available before we make any recommendations for children, especially those who are below 12 years of age. I think we need to have good data to make recommendations for additional dose or a booster dose.
Okay, Dr. Salunke, will it become like a seasonal issue now, at least for adults? Of course, for children, as Dr. Pandit mentioned, that some data will be required.
As and when we are going to enter into the phase of endemicity, which we are not right now, as and when we are going to enter into that particular stage, and as and when the whatever strains that will be circulating that time, they are going to have that particular range and not something which is going to be highly virulent. I'm pretty certain what we are seeing now, H1N1 situation in our country, influenza kind of an illness, we are going to have these COVID-19 variants of that time following the same pattern. But as of now, we are not going to say that we have reached that stage, but eventually it will, definitely.
Okay. One question I have for Dr. Ravi Mehta as well as Dr. Rahul Pandit, and this is about vaccination of teenagers that's also simultaneously going on, because here I have been speaking to many people in the office as well, and many feel that, the government should first focus on ensuring that school-going children are vaccinated, because even if we look at the data right now, teenagers in the age group of 12 to 14 have received the first dose. Just 45% of the eligible population has received the first dose. So shouldn't the focus first be on ensuring that children are vaccinated, given the fact they've started going to schools now, and many states have even dropped the mask mandate, for example, Maharashtra? Dr. Ravi Mehta first and Dr. Rahul Pandit.
Yeah, so it's a very, it's a public health debate. It's going on for a while. How do you do it? Actually, vaccination has become a very layered thing. We started off with the high-risk population, the elderly, then we opened it up to the mobile, then we come down to, say, adolescents, and then we're looking at children below less than 12 years and so on. So currently, since COVID is at an ebb, it's a question of at least get some into most, at the same time enhance those whose immunity is coming down. The government, whatever we have so far understanding, doesn't look like it's mandating everybody. It's saying that this booster is available to you in private hospitals. I don't think that the impetus of push on children is coming down. Yes, energy needs to be put into it. And typically when COVID numbers rise, energy goes into vaccination and then it ebbs when COVID numbers fall. So to put it succinctly, children, focus should go on, do your best. Whatever current booster dose is a recommended dose available in private hospitals, not mandated. Lastly, let's not forget that we have learned colossally the disease in children is not bad at all. At this point, it causes infection, which is very mild, and there's hardly been any onslaught of seriousness in this population. So if you put all that into perspective, I think it's push the kids, do as much as you can, and follow this current policy, and then just keep an eye on COVID and see its behavior.
Okay, Dr. Rahul Pandit, I want to give you the last word on this.
Yeah, look, I think we should be continuing with the vaccination for children as the program is currently being run. Try and do as much as vaccinations as we can. I do understand your concern that some of the regulations which were mandatory before have now been lifted down. But that doesn't mean I completely concur with Dr. Ravi Mehta again that the disease in children has not been that severe, fortunately, for all of us. And we should continue with the vaccination and COVID appropriate behavior to whatever extent we can enforce. It's difficult for that age group to completely follow it, especially in the school environment. And we should not change our path. There doesn't seem to be any urgent need to change gears as far as that age group population is concerned. I think we continue with the way we are doing right now.
All right, gentlemen, thank you very much, all of you, for joining us here on Urban Debate on Mirror Now. A new phase of India's vaccination drive is set to take off from Sunday. So all those who will be eligible, our doctors tell us that they should go out and get themselves vaccinated with this booster dose or precautionary dose, as it is called here in India. With this, we will slip into a very, very short break, but then